Hello and welcome. You're watching Herald TV and another episode of Dotor in the House. With me, I have Dr. Sheldon Pereira. He has completed his BPT from KLE's Belgaum in 2006 and a master's from Mangalore. With 16 years of practice in Goa in physiotherapy, he right now runs Physiologic, a clinic for all your physiotherapy needs. And today we're going to discuss specifically with him about osteoarthritis. And without delaying much, getting right into the episode. Welcome, Doctor, to the episode of Dotor in the House. And let's get to the point. The first question that I put forth to you is, what is osteoarthritis?
Sure, thank you for the introduction. Osteoarthritis is basically a condition wherein the knee starts wearing out. The cartilage starts thinning and the bones that form the joint start approaching each other, and as the bones start grinding against each other, that's the time when the pain becomes really severe. And it's most commonly found in the weight-bearing joints like the hip, the knee, the ankle, sometimes the back, the fingers also in certain cases. But most commonly we find it in the hip and the knee.
Okay. Doctor, as you know, this show is also about our audience sending in questions, and we have one such question from Margaon, from a boy called Azhan. We'll listen to the question and then we'll move ahead.
Surely.
Hi, my name is Azan and I'm from Margaon. And my question to you, doctor, is that what are the reasons and what are the causes of knee arthritis?
Okay, basically, Azan is asking us here for basically, we simply put it as a classification. There are two types of osteoarthritis that we talk of. One is a primary and the other one is secondary. Primary osteoarthritis is arthritis where we exactly cannot put a finger on the cause. It exists, but we do not know what has actually brought it on. We do not know an obvious reason for why it has started. The other type of arthritis, osteoarthritis, is called as secondary osteoarthritis. In secondary osteoarthritis, there could be so many things, so many reasons. We also call them as risk factors. The first, that is most profound, is obesity, where people have put on a lot of body weight and the body mass is going through the weight-bearing joints, especially the hip, knee, and the ankle. The second one is any injury, sports-related. It could be a motor vehicular accident, it could be a previous surgery around that particular joint, and other reasons could be lifestyle, some people who are living a sedentary lifestyle, they are found to have more articular issues, and even some of them are recently finding some correlation with arthritis and diabetes and other hyperlipidemia or other lifestyle disorders also.
So there's a long list of lifestyle diseases also related to arthritis.
Yeah, right now the latest citations is going to bring this up. Okay.
So doctor, if I ask you, what is the prevalence of osteoarthritis in general population?
In general population, mostly beyond the age group of 60 or even from 50. Nowadays we are seeing it a little bit early now. So from 50 to 60 years onwards, at least 80% of the general population will be showing at least one sign of arthritis.
Okay. And is there anything which is younger? Because nowadays with a lot of youth getting in for gyms and physical activity, but not able to get the proper guidance while doing all these exercises. Do you think that there would be a prevalence of amongst the younger generation also?
Yes, I do believe that, because if the form is not right, then you're wearing out your joints.
Okay.
So yes, if you do the exercises, particularly when we speak of weight training, when we talk about weight training, wherein you're loading your joints with heavy, massive weights, and if the form is not right, if your muscles are not developed enough to go in for that kind of a category of weightlifting, then yes, there's going to be some wear and tear.
And like my mother or our grannies, everybody has heard stories when they used to walk distances, climb up hills, and because of that, they would have joint pains in their later part of the age when they cross 50s. But we see that now, despite all the facilities that we enjoy, we tend to, we at times when we get up in the morning and I have a very severe backache. So is this again due to the lifestyle, or?
I would rather say that those people of the previous generations were better than us. Why? Because they've been accustomed to do these kind of activities on a regular basis. So that's what it was like, you know, we need a workout to burn our calories, you know. They had to walk to their work, they had to walk to school, they had to walk everywhere, wherever they went. So there was a lot of exercise happening, you know, the joints were more mobile, you know. Basically a human joint, or any joint for that matter, we are designed actually for movement. Okay, the joints are designed for movement. It is built to move. It's like the diesel engine, you know, you don't move it, you know, it can get freeze, and then you need to decarbonate it, and you know, all those things that come up. Something similar here happens with the human joints, and we need to keep them moving. And I truly believe that as we are moving more sedentary, we are like increasingly becoming more dependent on automobiles and all, you know, we are approaching this problem a little bit more faster.
Okay. And can early detection of arthritis improve the outcome as far as the disease is concerned?
Of course, definitely. Now, if you detect something early, we can start treating it early. So, you know, this is the place where you catch it actually, because arthritis is something that once if it is formed, it's going to progress. So, if you hold it, if you catch it early, then we can slow down the progress. We cannot, of course, altogether negate the diagnosis. We cannot cancel out on the diagnosis. We cannot cure it. But of course, we can reduce the rate of progression of arthritis.
Okay, so what you specifically are saying, is this about the pain part of it, because again, once your bones are having wear and tear, you cannot, is there a possibility that you get back to the original form, firstly?
Very difficult, and at least we have never seen it in a clinical practice that somebody goes back to a pre-arthritic condition. Yeah, that never happens, because once the wear and tear is there, you know, then it's progressive. And what happens is, once there is basically the cartilage, you know, it's not exactly a wear and tear, it's basically like a destruction of the tissue, destruction of the cartilage. So to really rebuild it is something that is too far to say. But what we can do is that we can at least maintain it. Okay, try to see that the repair is going on, which can at least match the damage rate. So there's a damage that's happening in arthritis, and there is also repair happening at the same time, but the damage rate is higher than the repair rate, you know. That's what makes it progressive.
So I was going to ask you, is when we say it's going to progress, so ते म्हणतात की ना हाजे फुडें म्हजे पांय मोडून वतले काय म्हाका चलपा खातीर फक्त दूख कमी जातलें अशें जावपाचें आसा?
पळय, आता जेन्ना आमी म्हणटा दुखीचें म्हणटा पळय, आता दुख इज ओनली, पेन जे म्हणटा दुख म्हणटा इज ओनली वन सिम्पटम.
ओके,
ते फक्त आमकां सिम्पटम तो फक्त पेशंटाक फील जातलो. बट एक्चुअली द पॅथॉलॉजी अंडरनीथ the underlying the condition is that there is some cartilage destruction going on, and it is not only the cartilage, the bones are getting worn out, the bones are expanding, you know, in order to take the pressure or to, you know, minimize the tension, you know. So we are actually seeing structural changes happening inside. It's not just the pain part. There is so much more to add to it.
हो प्रश्न विचारपाचो हेतू तोच आशिल्लो, कित्याक लोकांक नॉर्मली अशें दिसता की म्हजें दूख हो अल्टिमेट ताजो कॉज. जेन्ना दुखता खंय कितें पांय, अच्छा भितर कितें जाता तें लोकांक खबर नासता, आनी त्या खातीर तें दुखता तें दूख म्हजें कमी जावपा जाय. भितर मागीर कितें जाता तें दोतोराचो कन्सर्न. सो मुवींग ऑन, फुडलो प्रश्न घेवया. रसिका नायक बिचोलीच्यान, ताजो एक कॉल आसा.
Surely.
माझें नांव रसिका नायक, हांव बिचोलचें. म्हाजो प्रश्न असो आसलो की नी आर्थरायटीस प्रॉब्लेम कसो कॉज जाता, आनी तेचेर घराक कितें ट्रिटमेंट करूं येता और कितें एक्सरसायजीस करूं येता, आनी नी कॅप घातल्यार कितें हेल्प जाता.
ताणें 3 प्रश्न रसिका विचारले. एक तर स्पेसिफिकली नी आर्थरायटीस, दुसरें नी कॅप बद्दल. सो दोन हाचेर, बिकॉज तिसरो जो आसा तो एक जनरल क्वेश्चन आसा.
Absolutely, Shoaib. How do I approach this question? Let's first, you know, speak about what we can do about it at home. Ghara kite karpak jata. Now, first of all, when anyone who has got knee arthritis, most of the patients, they respond to heat therapy. Heating the joint. Heating the joint is very simple. Either you have an electric pad, or you use a hot water bag, or you take a simple cloth and you dip it in hot water and apply it on the like part or the joint, here the knee. And this gives a lot of relief, because most of the patients with osteoarthritic conditions, they get aggravated in winters and in rainy seasons. So heating is something that will really help in negating the temperature drop that we see in this kind of seasons. आणि दुसरें म्हणटा ते पेशंटान कंटिन्युअसली मुवमेंट चालू दवरपाक जाय. Example, if your knee is arthritic, kneeचो movement आसपाक जाय. Up and down, lifting, तूं बसला, it should be moved.
Okay.
You are lying down, it should be moved. Continuous movement आसपाक जाय. लोक थोडे कितें समजता की आपूण कमी चलतलो, आपूण मुवमेंट कमी करतलो जाल्यार हांव आनीक बरो आसतलो, पेन म्हाजी कमी जातली. That is a wrong concept. You have to move. Sometimes it's very painful, but you have to move through the pain to yield the results.
Okay.
The other thing that she brought out was about the kneecap. The kneecap also works on a very similar basis like heating the joint. So the knee cap is actually an insulation. It insulates the knee joint, it traps the heat, आणि भितर तुका warmth, तुका गरमी मेळटा jointaक आणि तितून तुका relief मेळटा. Secondly, it also supports the structures, supports the muscles, just like how athletes or footballers, like in Goa, football is the thing. So आमकां knee support घातल्यार कितें जाता मातशें you feel that like sensation of being protected, and you feel you are encapsulated, and you can do a little bit of extra run or an extra effort that you can put. The same thing happens with the kneecap. The kneecap will protect, will maintain the heat of the joint. It will also give you pain relief. It will also give you a little bit of that sensation. When we like press a particular painful part, we feel good. The kneecap also works on that. That's called as mechanoreception. So it also works on those bases. So it has got multifaceted benefits.
So when you talk about kneecaps, doctor, because now kneecaps are available of different types.
Yeah.
And also many a times kneecaps, those who are coming into market just for profits, they are not actually bringing in kneecaps. They are just taking a plain cloth and or elastic, and they are just putting it together and calling it a kneecap. So that is why if you also just put some information about what kind of kneecaps should it be, how the elasticity should be of the kneecap.
Yeah, basically there are many leading brands here. I would not name them, but go for something that is leading, something that is really been out in the market for many years. It's something that is trusted and proven. You understand? There are many new people also, new entrants are also there, but we should stick to those who have been out there for a long time.
So how much strength should it have normally? Because I personally have used, and the ones I begin to use with was very tight, so then I started feeling my leg was getting suffocated, so therefore I had to replace it with another one.
Got it, Shoaib. What do you want to ask me? Actually, basically this is about the size.
Okay.
So there is small, there is medium, there is large, there is extra large, you understand. You need to measure your knee girth, by using a measuring tape and see in inches or centimeters what is the girth of the center of the knee. And according to that, you decide which size you belong to. So if the sizing is wrong, if it's too loose, it will be ineffective. If it's too tight, it will obliterate the blood flow. The venous return, the return of the blood will not be good, and sometimes swelling can appear below the kneecap. So, you have to know the size right.
All right. Now, when we talk about, especially now, knee injuries or arthritis for that matter, is it always a necessity that I go to some doctor? The first thing that I need to do is I need to get an X-ray done to detect whether I have arthritis, or is it possible without an X-ray also?
Actually, an X-ray is not needed at the beginning phase. So, whenever you go to a physiotherapist or you go to an orthopedician, he will examine you clinically. He will feel the joint. He will check for your movements. He will see what is painful, which movement is painful, which muscle is involved, which ligament is intact, not intact. And then based on that, when all things are ruled out, and then he will suspect something arthritic. And then if need be, if he's still not sure, then he may ask you for an X-ray. Most commonly, this is not needed on the first visit. Unless until the doctor is skeptical of you having a hairline fracture or something of that sort.
Okay, doctor, at this note, we will take a break. And on the other side of the episode, we will discuss on knee replacements and take more questions from our audience. I request you to keep watching Herald TV. We'll be right back. Welcome back. You are watching Dotor in the House on Herald TV. With me today, I have Dr. Sheldon Pereira, who runs Physiologic, a clinic for all your physiotherapy needs, which is located on the Bambolim Santa Cruz Old Highway. Doctor, moving ahead, the first question that I would put across to you is, many are skeptical about knee replacements. So as a physiotherapist, what is your opinion about knee replacements?
Knee replacement is the ultimatum of any knee arthritic osteoarthritis. So, like, if somebody who has progressed to that an extent where the cartilage damage is so severe, the bones have started articulating with each other without and the patient is unable to move, unable to sleep, there's constant pain, then the ultimatum is that he has to go for a knee replacement. And yes, of course, people are very much skeptical about it, but we have seen most of the patients come out fantastically. And yes, I am not against it, but I'm for it actually. Where it is needed, yes, it is needed.
Okay. And in what kind of cases would a knee replacement become a necessity?
Like I said, before, the moment the cartilages are destroyed to an extent where the bones have started approximating or they are grinding against each other, then that's the time that you need actually,
Okay, we'll move on to the next question from our audience, and this is an elderly person, Mr. Marcos from Betul.
Okay.
म्हज्या रायट सायड लेग आहा न्हू ताका ऑपरेशन करूंक ना. लेफ्ट सायड हांवें केल्लें म्हणटच जायते वर्सां जालीं लेफ्ट सायडीक केल्लें रायट हांवें करूंक ना पूण एकदम दुखता चलोंक जायना म्हज्यानी. म्हाका मातशें कितें तुजें ऑपरेशन करिनासतना रेमेडी आसल्यार दिता बाबा म्हाका.
This is specifically about, as I said, going under the surgery.
Yes. So this gentleman wants to avoid the surgery as far as possible. See, Shoaib, let me just put it in a very simple way, this way, Example, if a patient walks to me and I know that he has got knee osteoarthritis and I know that it's developing, it's progressing, what as a physiotherapist I can do is that maximum I can delay the knee replacement surgery.
Okay.
I cannot kind of cancel on it, but I may increase the lifespan of his knee, of his God-given natural knee, as much as possible.
Okay.
And then ultimately he might have to go for a knee replacement, but what we can do is that we are increasing the span. Consider if he's 50 years old, so that I can see that I can push him for another 5 to 10 years and then allow him to be operated at about 60. Why? This pulling on is important because even the knee that will be replaced, the implant, has a lifespan of approximately 10 to 15 years.
Okay.
So if the patient outlives that period, he will have to go for a repeat.
So actually, that was going to be my next question. I mean, why, does somebody need to delay it further? Because if somebody, normally for surgeries, people say the younger you are, the better it is. So in this case, it would be because the longevity of the knee replacement itself would be 10 to 15 years, and the person may have to go a repeat.
Absolutely, very important query, Shoaib. Thanks for bringing it up. Here actually, we need to find a sweet spot between how long and how much not. Why? Because the more you delay the surgery, as you get advanced with age, the complications or the possibilities of complications increases. It could be some kidney issue, it could be liver issue, it could be the heart that may not be able to go through a surgery. So it's a sweet spot, We cannot get somebody operated, at 50 or 40 or 45, and that's too early because that person will have to go for repeated revisions.
Right.
And if you wait too long also, the possibility of the patient's safety during the surgery becomes a question. So it has to be somewhere in the range of around 55, 65, 70, somewhere there.
Okay. We have the next caller in. He is Shivam Naik from Kurchore.
Okay.
Hi doctor, my name is Shivam Naik and I'm from Kurcharam. As a physiotherapist, I just want to know how can a physiotherapist will help a patient who is suffering from knee arthritis?
Basically, he's asking about the role of a physiotherapist. That is your role specifically as to...
Of course, this is a very big question, Shoaib, and the role of a physiotherapist is right from even before arthritis begins. So physiotherapist need not work only when arthritis is diagnosed, but he can start working on it even before it is diagnosed. So here the old adage comes into play or into importance is that prevention is better than cure. So if we start working on an individual's joint and see that it is maintained healthy, the muscles are strong, the tendons are maintained, then we can ensure that arthritis can be kept at bay.
Okay.
So the prevention is the first thing that as a physiotherapist, my role will be to prevent anyone from getting osteoarthritis. That is the first thing. The second thing, early detection. Being a physiotherapist, many times people walk into us, just to be sure of what is happening to their joint. Sometimes people are skeptical to go to like doctors, physicians, because they want to avoid painkillers, they want to avoid the entire like pharmacologic
Yes.
like drug system. So people are very much aware about these things, and they are very much sensitive also, and it's picking up here, especially in Goa, it's picking up. So even the youngsters want to avoid painkillers and muscle relaxants. Even if they hit the gym, they want to avoid it as much as possible. So like because of that, they walk into a physiotherapist thinking that a physiotherapist will be able to help him out without any drug. And yes, we come into there and we can strengthen the muscles, we can maintain the range of motion, maintain the flexibility of the joints, and start discussing so many things at an entirely different level that we can really, actually help a patient in like prevention of osteoarthritis. Now, those who have got osteoarthritis, we can treat them at different levels. When they have just started, where there is a lot of acute pain, there is swelling, inflammation, we can help them there with the pain control. Then even in later stages, those who are chronic, we can help in the mobility of the joints where stiffness comes in. And we can maintain the strength there also and see that optimally the range or the movement, the degree at which the knee bends or extends, we can help them in maintaining that. So the role is all over, even before arthritis, after arthritis, even after knee replacement, physiotherapy is a must.
Is a must, even after knee replacement.
So physiotherapy is going to be one of the mainstay treatments all over osteoarthritis of the knee.
Okay. We have the next caller, MJ Fernandez from Margao. Let's listen in.
Yes.
Okay. My name is MJ Fernandez, speaking from Margao. I have a right knee arthritis. What are the solutions you can give me, please?
Asking for very,
Yeah.
I mean, he's very specific
Yes.
that he's
Yes.
got knee arthritis in his right knee.
Yes. I would like to tell the gentleman that he needs to like go and see a physiotherapist and try to chart out a plan for him. Especially certain exercises are tailor designed for certain patients.
Okay.
We cannot stick like copy paste the treatment protocols from the textbook to the patient directly. We got to see if that patient is apt for that particular protocol. So he needs to see a physiotherapist. He needs to see an orthopedician also to rule out any other issues associated with osteoarthritis, and start with this physio as soon as possible.
Yeah, and that is one of the things that happens, as you said, people try to avoid taking in painkillers and stuff, and therefore they try, okay, तुका दूख आशिल्लें जाल्यार तें तोच हांवूय करतलो, दोतोरान एक पांय हालोवपा लायिल्लें तर हांवूय तेच पांय हालयता, अशें करून लोकांक दिसता की ओके म्हजे वतले. But is that a possibility? I mean, how far people can rely on such ways?
See, basically they need to take, they need to seek professional advice as far as possible, because we are dealing with arthritis, and arthritis is a very broad term, and osteoarthritis itself, is a very big topic to discuss. Okay. So, it's good if they go to somebody who understands this condition and who can put his finger on the problem, and accordingly they can plan out a treatment. Like it could be medications, it could be surgery, or it could be physiotherapy. They have to go for one of this or all three.
All three.
Yeah.
Okay. The next caller is Rovina Rodriguez. She's from Taligaon. Let's listen in.
Hi, doctor. I'm Rovina Rodriguez, and I'm from Taligaon. My neighbor was suffering from arthritis. Her joints were paining. She had stiffness in her bones. It was very difficult for her. So she was told to go to Bombay for her treatment. And there they advised her to go for acupressure. So I want to know like how effective acupressure is with arthritis.
Now, acupuncture, acupressure, dry needling, these are the things like that have caught the fame actually, they have become viral. And I think so these sciences have come up more of actually holistic approach towards this kind of conditions. I would say that acupressure as compared to acupuncture is more like conservative, as it is non-invasive. You do not pierce the like body tissue. You do not enter through the skin into the deeper tissues. So sometimes acupressure works, yes, but in very severe conditions, acupuncture is known to give more pain relief, at least for that very moment, So it helps in the acuteness of the pain, helps in bringing down the inflammation, and at least we do not know on long-term basis how acupuncture will really be effective, but short-term like goals for short-term pain control, it's very effective.
And this, apart from this, there's one thing that I would just very quickly ask you is about people trying to get those small gadgets that you're normally available during the fairs or in the market, and in the name of acupuncture, acupressure, they apply. How far should people be doing that?
We cannot say anything about it because there's no evidence to like support the claims that they give. Yeah.
Okay. The next caller is Taslim from Porvorim.
Hello doctor, my name is Taslim. I stay in Porvorim. I would like to ask you one question. One of my relative has an issue in her leg. Throughout the day her leg starts paining. I would like to know, is it because of arthritis or some other issue?
Okay, Taslim, now here we need to get into differential diagnosis. Now this is something very professional and has to be done with an orthopedician or a physiotherapist, and we have to rule out, when she speaks about leg pain, it could be caused by some musculoskeletal disorder, it could be a neurological disorder, it could be a nerve being pinched somewhere, it could be like something to do with the back also.
So when you say, just for the common audience,
Yes.
if you could break down these terminologies, would be a better thing.
So when we say musculoskeletal, are we dealing with a fracture?
Okay.
Are we dealing with a ligament sprain, or are we dealing with a muscle strain or a muscle pull or a tear, or it is arthritis? Okay, like this is one segment. Other segment, is there a nerve being compressed somewhere in the leg? Because the nerve that comes to the leg is actually, it arises from the spine, from the low back. So, we need to check there. Or else, it could be something related to the blood flow. Is the blood reaching the leg, or is there a problem with the blood returning from the leg? So all these issues have to be ruled out thoroughly. Only then can we address to this question that Taslim has asked us.
So anybody who just has a knee pain does not necessarily have knee arthritis.
Absolutely.
First, please get it diagnosed,
Yes,
and only
get it
then.
diagnosed, yeah.
Okay. Also added to this is, as you said, ligament tears. Generally, again, people think over a period of 10 years or 15 years. If they had mostly ligament tears, even younger generation people playing sports or running around, they do have, or even due to accidents. Over a period of 10 years, they think, okay, this is going to cause me knee arthritis now. How far is this conclusion true?
To some extent, it is true. Okay, to some extent, it is true. To some extent,
to some extent.
We cannot label a person with a like cruciate ligament injury or a collateral ligament injury of okay, you're definitely going to have osteoarthritis of the knee. No, you cannot say that. That depends how he carries himself. How is his lifestyle? Is he working out? Is he maintaining the strength of his muscles? Is he doing some kind of sports? Is he into aerobic training? All these things will start determining whether he is a candidate to go for osteoarthritis or not. So activity is very important. Yes, there are people who will be more susceptible after injuries, after ligament injuries. Yes, they're susceptible to get an arthritic knee. Okay, but it's not necessary that they will get.
And the last question before we go into concluding the episode: what could avoid one's having osteoarthritis? I mean, how can one avoid getting into trouble of this?
Oh, this is $1 million question. But yeah, let me attempt this one. Okay, let me attempt this one. I feel the first thing what we can do to avoid osteoarthritis is keep your weight under check.
Okay.
That is the best thing. The moment we speak about weight, we have to speak about diet, and we have to speak about living an active lifestyle, exercising, gymming, swimming, cycling, walking, running, whatever, any activity that you do on a regular basis, and be consistent.
Okay.
Be consistent. This is going to be the best thing what I would suggest any of my friends to do. If they ask me this question, the simplest form is, you keep your body weight under check.
Okay. Well, on that note, we are concluding this episode of Dotor in the House on osteoarthritis. Next week, we are going to have Dr. Sheldon Pereira with us, and we will be speaking about slip disc. Doctor, if you would just put a highlight on that issue.
Yeah, slip disc basically, as the name suggests, the disc which is there between the vertebrae is slipping out. That's the reason why it's called slipped disc. And it slips out and it starts encroaching the nerves in the back or the spine.
Okay.
So, that's basically slip disc. So, we are going to discuss on this.
So, on 17th of July, we will be discussing slip disc. Please send in your queries before that, and we shall have Dr. Sheldon responding to your questions. Until then, keep watching Herald TV. Watch us on YouTube, Facebook, and please subscribe Herald TV online so that you are able to get all our episodes regularly. Thank you for watching Herald TV.